I'm Jarrett Culver. I'm the guard for the Minnesota Timberwolves, and this is my good friend Addie. We met a while back earlier this year. So we just want to say thank you for taking time out and doing this for us, and answering some of our questions that we have. And we want to thank you for everything you're doing right now.
Thanks, guys. Thanks for the invitation to be a part of this and for also helping us to kind of get the word out.
During this time of the COVID-19, just what do you see the next few weeks and next few months, I guess, looking like for Minnesota, in this area or just the world, I guess.
Yeah, so I know a lot of people are kind of wondering what is in store for us in the upcoming weeks. I think the first thing to say is we're really thankful to everyone in Minnesota, both of you included, who has really been following the recommendations about staying at home as much as possible. This has really helped to keep a lot of people in the state safe and prevent a lot of people from getting sick. And so, unlike some parts of the country where we've seen kind of really big waves of people getting sick and then hospitals having difficulty taking care of so many people all at once, here in Minnesota, we've all managed to do a really good job of kind of slowing that down instead of a wave to kind of a trickle or a stream of patients. And so far, the hospitals and healthcare centers are able to provide really good care to those people who have gotten sick and needed to go there. A lot of that success, as I mentioned, has come from people staying at home and kind of limiting contact with people outside of their house. So definitely something we're still really recommending everyone keep doing. I know it's not easy. For now, we're really still encouraging everyone to stay home and stay safe.
You got any questions, Addie?
Um, will this be like a seasonal virus like the flu?
So that's a great question, Addie. It's a question that lots of the doctors and scientists have been wondering about as well. I think we're not really going to know for sure for a while longer. There's kind of a couple of possibilities. It might be kind of a one-time thing, and once we have a vaccine, it's possible that it might go away after that. But the other possibility that people are wondering about is if it might stick around and tend to peak up at certain times of year, like we see with flu in the fall. And so a lot of people are thinking about that great question and wondering about it. We don't know the final answer yet. There's kind of a few different possibilities that we're looking at, and really time will tell us kind of which direction things go in.
I was wondering what has been some heartfelt or uplifting moments you've experienced during this time.
Yeah, so it's really been great. All of us in healthcare have really appreciated all of the support that we're getting from people in the community. And so we've seen lots of positive messages from people. We've seen everyone putting hearts up in their windows. All of those things have been really kind of uplifting for us. Really, the most uplifting thing is just having people listen to the recommendations and staying home and keeping themselves and their families safe. For us in healthcare, that's kind of the best thing that you can do to help us out. And we do really appreciate a lot of the big sacrifices. So I know with the NBA games being canceled, I know a lot of people were disappointed. I'm sure all the players were as well. But those difficult types of decisions really have saved lives. And so we really appreciate everyone that has kind of thought really hard and carefully about doing things like that and implemented those types of things to keep people safe and healthy. So those have all been fantastic. There's been a lot of people who are helping out in the community, so dropping off food or donating to food banks or donating to charities. A lot of people are going through a really hard time now here and across the country, across the world. And so people who are in a position to help out in the community like that, we really appreciate them doing that as well.
I've been friends with Addie for a while and been learning about everything about Addie, and I was wondering, are people with cystic fibrosis at a higher risk of the corona?
Yeah, that's a great question, Jarrett. I'm sure, Addie, you've been probably wondering about this as well. So, as I mentioned, we're still learning a lot about the virus. Just this week, we got kind of one of the first scientific reports about people with cystic fibrosis. So, these are people who are living in Italy where they've seen a lot of cases. And the initial reports from there are actually quite reassuring. So, it's kind of good news. Firstly, they talked about 42,000 people in Italy who got sick. Only 10 of them had CF. So I think people with CF, it sounds like, have been doing a really good job of protecting themselves from getting infected, because that's a pretty small number, which is a good start. And those 10 people did really well. So they didn't have very bad lung disease, and they didn't get very sick.
Do you think we'll be able to start school in August next year?
In August? That's a really good question. I know lots of kids are wondering about when they might be able to go back to school. I think that decision is going to have to be made by a lot of different people kind of thinking together and looking at the numbers of what is happening specifically here in Minnesota, and probably looking in different cities as to what's happening, because we really don't want to open up schools until it's really safe for kids to be back there. When you go to school, as you know, you're around lots of different kids from lots of different families, and so we really don't want kids to start getting sick once they reopen the schools. And so it's hard to predict that far ahead for us right now, but it's definitely something that people are really looking at closely. And as soon as they think it's safe to reopen the schools, I'm sure that they will be doing that.
Well, we thank you. Thank you so much for giving us more information and taking your time out. And we really appreciate everything you're doing. And of course, spending time with us and talking to us and making us more knowledgeable about the situation. So we just want to thank you for that.
Great. Thank you guys both for doing this and for helping to help raise awareness about what people can and should be doing right now as well. We really appreciate it also.